Veterinary medicine is a rewarding field, but it comes with its fair share of challenges. Every day, veterinarians are faced with complex cases that require careful diagnosis and treatment, often with limited information and very sick patients. Today, I'm going to focus on one of these challenging conditions in ferrets, T cell lymphoma. It is important to understand and know what lymphoma is before we begin the topic. Lymphoma is the third most common malignancy in the domestic ferret. It is a hemopoietic tumor defined as a growth of malignant lymphoid cells that primarily affect the lymph nodes or solid visceral organs such as the liver or spleen. Unfortunately, there's no known way to prevent lymphoma in ferrets. This type of cancer can develop regardless of diet, environment, or care. While good nutrition and regular veterinary checkups can help detect illness early, lymphoma itself is not preventable. Lymphoma found in ferrets can be put into two categories, B cell and T cell. B cell lymphoma in ferrets is a type of cancer that affects the B lymphocytes, a kind of white blood cell involved in the immune system. It is the more common form of lymphoma. B cell lymphoma typically shows a slower progression and tends to respond better to treatment, giving affected ferrets more favorable prognosis and quality of life when managed appropriately. In Figure 1, it shows what B cells look like under a microscope. T cell lymphoma in ferrets is a rare form of lymphoma that arises from T lymphocytes, the immune cells responsible for regulating immune responses. Unlike the more common B cell type, T cell lymphoma is typically aggressive, progresses rapidly, and is often difficult to treat. Because of its fast spread and poor response to therapy, it usually carries a poor prognosis for affected ferrets. Referring to Figure 2, what T cells look like under a microscope. T cell lymphoma is a cancer of the immune system arising from T cells. T lymphocytes in ferrets are a type of white blood cell that plays a key role in the immune system, helping the body recognize and destroy harmful invaders such as viruses, bacteria, and abnormal cells. In T cell lymphoma, those T lymphocytes themselves become cancerous. Instead of performing their normal immune functions like identifying and destroying infected or abnormal cells, these T cells begin to grow and divide uncontrollably because they multiply so quickly and spread so aggressively. The normal immune system becomes disrupted, leading to organ damage, weakened immunity, and rapid decline. Signs and symptoms of T cell lymphoma include lethargy, rapid and sudden weight loss, dry coughing, and swelling of lymph nodes or around belly organs such as the spleen. Diagnosing T cell lymphoma involves several important steps. First, the vet must perform a physical exam to check for enlarged lymph nodes, organs, or any abnormal lumps. Next, samples are then collected for cytology and histopathology. These tests look at the cells and tissues under a microscope to confirm whether cancer is present. Immunochemistry, which is a laboratory technique used to identify specific types of cells within a tissue sample by detecting certain proteins or markers on their surface, is then used to identify if the lymphoma is coming from the B cells or T cells. Blood work also helps assess the ferret's overall health and can show changes caused by the cancer. Finally, imaging such as x rays or ultrasounds also allows the vet to see if the lymphoma has spread to internal organs. These tests help vets get a clear picture of the disease, helping them make an accurate diagnosis. Talking about this case study, a 12-year-old male ferret was brought to the veterinary hospital pet care in Sao Paulo with a few days of prostration, anorexia, and lethargy. On exam, the ferret was dehydrated, hypothermic, and had pale mucous membranes. Abdominal palpitation revealed a firm mass in the stomach region, raising concern for an internal abnormality. Ultrasound showed enlargement of the liver and spleen, with areas suggesting a mass or infiltrative lesions. Fluid therapy was initiated, but sadly the ferret passed away shortly after. Necropsy revealed enlarged spleen and liver with invasive growth. Microscopic examination showed a dense proliferation of abnormal round cells with large nuclei and high meiotic activity in the spleen and liver, consistent with lymphoma. This case highlights the aggressive nature of T cell lymphoma and the challenges in diagnosing and managing the disease in ferrets. Figure 5 shows ultrasound imaging of the liver and spleen that was taken from this ferret. In this case, the ultrasound revealed enlargement of both the liver and spleen, along with areas that appeared as masses or intense growths. On the picture, you can see arrows pointing to growths within the organs of that ferret of the spleen and the liver. Images were taken for this case study, and Figure 6 shows spleen under the microscope. This showed lots of abnormal round cells that looked very different from normal ones. These cells had big, active looking centers and were dividing very quickly. There are many unusual or irregular cell divisions happening, which is a strong sign of cancer. It was also indicated that the liver had similar findings. Figure 8 shows the microscope image of also the spleen, but it shows cancer cells that tested positive for CD3. This is a marker found on T cells, which this indicates that the cancer came from T lymphocytes, which resulted in T cell lymphoma. The main treatment for T cell lymphoma in ferrets is chemotherapy using drugs like cyclophosphamide and prednisone, which can help shrink tumors and improve quality of life. However, it rarely cures the disease. Corticosteroids may also be used to temporarily reduce symptoms, especially if chemo is not an option. However, alongside these treatments, supportive care, including fluids, nutrition, and pain management, is important to keep the ferret comfortable and maintain quality of life, since T cell lymphoma is very aggressive for ferrets. In conclusion, T cell lymphoma in ferrets is aggressive, and unfortunately, only about 10% respond to treatment. This highlights the urgent need for more research into effective therapies. Continued study, along with proper veterinary care, can help give ferrets more time and a better quality of life, even in the face of this challenging disease.